Hi everyone, welcome back to my channel. So today I wanted to talk about gender, doctors, and chronic illness. Um, and basically, does your doctor's gender matter? I have done already a video on how your gender can affect whether you get quality treatment or not. And we know that there are lots of studies showing that there is a disparity between how men and women are treated by doctors, and also how people of different ethnicities are treated. That's kind of something that we sort of already know. Whether some people want to accept that or not is a different story. But I don't see a lot of talk about doctors and their own gender, and whether that can affect the course of your treatment or whether you will eventually get to a diagnosis. And I'm going to speak from my own perspective and my own experience. There might be people out there that are like, it doesn't matter, it doesn't make a difference. But from my personal experience, I do believe it makes a difference. And I guess I'll tell you how I arrived at that conclusion, because it's one thing to say, yeah, it does make a difference. It's another thing to actually show, um, you know, how I arrived at that conclusion. Um, so I've seen many, many doctors during the course of my illness. At this point, I've been sick for close to, I would say, 16 to 17 years. And I've seen probably well over 20 doctors, probably over 30 doctors at this point, different doctors. Right now, I am at a place where I have a team of doctors, a stable team of doctors that I've had for probably the last, I would say, three to 4 years. And I will tell you right now, all of them, with the exception of one, are all female. Um, so here's kind of my story, and I will direct you to a couple of other vlogs. I just did a vlog on the worst doctors ever, which all happen to be male. And so you might want to watch that one as well. It may be already posted. It may, not be posted yet. But that will be also kind of a good video to refer to as I'm making this one. So I had been sick for many, many years. I had already had one diagnosis from a doctor, but I was having issues with that doctor, and I knew that I had something else. And that's also another story. Go look at my SPS diagnosis video. But I also was currently seeing a therapist at that time that I really wasn't, she really wasn't doing anything for me. And yes, she was a female. She wasn't a bad therapist, but she wasn't great. And so I decided to seek another therapist, to find another therapist, because things were getting really tough for me at this time. I really needed to be on a medication. And, I had lost this medication. I really needed to find a way to get back to it. And, I knew that I had some kind of illness that medication helped. So, I just really needed the mental and emotional support. So I found another therapist, another female therapist, and I went and saw her a couple of times. And this is the one thing that I've noticed. I've had several different therapists, because they, for whatever reason, they come and go. Like, a lot of them are student therapists and they start their own practice, but they've all been female. The last, I think, 3 or 4 therapists I've had have all been female, and not one of them has ever told me your issues are psychosomatic. I've had male doctors, several, that have told me my issues are psychosomatic. But when I actually go to a therapist, I have never been told that my issues are mental. And none of these therapists have ever told me that. They have all encouraged me to continue fighting and moving forward, trying to find a diagnosis. I just felt that I was kind of in a rut with the therapist I was with. She was an older lady. She seemed tired. She seemed like she was just kind of over it. And so I found this other therapist, also a woman. And immediately she listened to my story and she said, why don't you go and see this doctor? Because at the time I didn't even have a primary care physician. I had a falling out with my Lyme physician, and I didn't have any steady doctor. And so she said, look, here's this doctor. She had stopped practicing for a while and now she's back practicing. She said, I think you should see her. She's really good. And, I think she might be able to help you. And so I said, sure, why not? I mean, I need a primary care physician and, I might as well, I need a doctor. So I went and saw this woman. She was an older lady. I would say probably about my mother's age. She was probably in her 60s at the time. And I went and saw her, and immediately she was just taking notes. She had like a little laptop, and right away, she wants me to tell her everything. And keep in mind that this doctor is through my insurance, so they have a very limited time. But I did consider the amount of time she spent with me to be more than the average, or than any other doctor had spent with me. And she really was paying very close attention to me. She did ask me, do you have a therapist? And I said, yes, I actually was referred to you by a therapist. So again, a female therapist refers me to a female doctor, and I told her the name of the therapist, and she goes, oh yeah, I do know her, and she's really good. And it just seems like female doctors listen to each other as well as listening to their patients. And so she took all the notes and she said, look, I don't know what you have. She said, but I can refer you to someone who might know. And to make a long story short, it still took a couple years, but I eventually got to a diagnosis because of her. She was sort of the one that got the ball rolling on this. And, she was just very diligent. So she referred me to a neurologist. The neurologist happened to be male. And he was just didn't listen. He was very intelligent. He did run, tests and things like that. But my appointments were like 5 minutes, maybe like 10 minutes at the most. And then I was out of the office. He was a smart guy, but just not very attentive. And to this day, he's still one of my doctors, and he's still not very attentive. He eventually said, look, I'm going to refer you out to a doctor at UCLA who happens to be female. He said, and she's going to be sort of the deciding voice in this diagnosis. He says, because I think you do have this, but, I can't just be the sole decision maker in this situation. So he referred me out to UCLA, and I saw this doctor. She was also female. She's a bit younger. I would say she's probably around my age, maybe a little bit older. And again, very attentive. She listened. I told her everything. I said, look, I've seen all these doctors. It's not complicated what I'm telling you. I've already been on this medication, and it helped me. It helped my symptoms in this way. And she did listen. And that's the one difference that I have seen with female doctors, is that they do seem to listen. Obviously there are doctors that do seem to listen and they really aren't listening. But she did, I don't know, female doctors just seem to be more perceptive to what you are saying. That's not to say that there aren't horrible female doctors, because I've had female doctors yell at me. I've had them basically tell me to leave them alone and that kind of thing. But, generally speaking, I have seen my female doctors pay attention to me. So eventually I got the medication that I needed through this doctor at UCLA. I also have a female urgent care doctor. Now, an urgent care doctor, obviously, if you go to urgent care, they're going to give you whatever doctor is available. But I will go out of my way for this specific doctor, because she listens. She's very quick too. She's incredibly fast to like put the pieces together and come to some kind of diagnosis or some kind of educated guess as to what it is that's going on with me. And she's been pretty spot on every time I've seen her. And I see her a lot. I mean, there was a point where I was seeing her like every month, sometimes more than once a month. She has never there was one time when we did kind of have a little bit of tension because I was really stressed out over something, but for the most part she has always been very, very patient. And I think that's also one of the other differences, is that female doctors tend to have a little bit more patience than male doctors. They tend to listen, they tend to ask, like, is there anything else, or they'll just ask questions in general. The one male neurologist that I still have does not really seem to ask questions. He seems to sort of talk at you and not really ask questions as far as like anything beyond how are you feeling, how are you doing. And these other doctors really do ask, like, is there anything else that you need? Like, they seem to do more of an examination as well. Oh, I also have a female oncologist hematologist, and she is also very, very attentive, to the point where I feel like she's almost overly attentive. Um, she does a breast exam every time I'm in there. She's ordered me 2 mammograms already. She wants me to do a third. And again, I think that comes from a place of being a woman, having treated other women with cancers, knowing the risk factors, because, she knows I'm a woman and she knows my medical issues and my background with, all my medical history. So I think women just have a sense of, I guess, a sense of urgency when it comes to other women. More recently, I had my first female ophthalmologist. No, she wasn't an ophthalmologist. An ophthalmologist, I think something like that, a eye doctor. And she was this tiny little lady. And, she takes me into the exam room and she's talking to me. And she kind of rubbed me the wrong way at first. Because she was kind of short with me and stuff, and she kind of like wanted to do the examination quickly and all of that. But then she started talking to me and she said that she had Hashimoto's, which is an autoimmune illness. And she said, yeah, autoimmune illnesses, they wreak havoc on your body, but they also wreak havoc on your eyes. She said, so she says, I know where you're coming from. She said, she said, it sucks. You have to be on all kinds of diets. And I mean, it was almost like this relating to me that I don't know if that's just like a female thing or what, but she sort of was trying to relate to me and sort of trying to meet me, I guess meet me halfway, and in some, trying to make me feel more comfortable. And then, my prescription came out bad, and I was like, look, this prescription's not good. And she took me back in, and she was even, she was much better than the first time. She was like, I'm so sorry. And, sometimes a very small change can make a really big difference. And she was so kind and so attentive, whereas the male ophthalmologist that I had to see, for further testing was just like very dry. And he's like, you just need more tests. And I don't know if it's just more warmth because they're women and I guess women are just conditioned to be that way, but I just do see more attentiveness. I've never gotten anywhere with male doctors. If you watch my horrible doctors, or the worst doctors ever video, I've had multiple male doctors even communicate with each other to sort of deny me care and to sort of tell each other, look, she's a liar, she's got psychological issues or something like that. And I don't see that with female doctors. They may tell me that they don't really know what's going on, or they may just kind of guess sometimes, but I don't think I've ever had, I've had them get frustrated. That's one thing that I do notice, is that female doctors will get frustrated and angry, but it's not a sort of like, well, you're the crazy one. They're not trying to convince me that I'm the bad guy. They just don't know what to do. And that sort of brings me to my next point. With the male doctors that have not helped me, or even the male doctor that I still have, there is this, and again, I'm kind of guessing and I'm conjecturing based on the way that they've talked to me, based on the things that they've done. There's this almost undertone or this vibe that they think you're stupid, or that they believe that you are, that they believe that anything that they say, you're just going to believe them because they're doctors. um, and that's something that I don't get from female doctors. Granted, I'm sure that there's some that do believe that you're less intelligent than they are, but with male doctors, I do get this vibe that, you're not intelligent, you're not smart. I guess arrogance is what I'm trying to say, but almost attributing, to the patient, that the patient is not really that intelligent, and I can pull the wool over their eyes. And I remember I had one, he was a Lyme literate doctor. I went and saw him a few times after I stopped seeing my own doctor. And I remember he would order tests and he would tell me that they were covered by insurance, and then suddenly I would get these huge bills. And, my doctor has always ordered tests, or the doctor that I eventually went back to has always ordered tests and blood tests, and the insurance always covered them. And it was the same stuff that he was ordering. And so I started to get the feeling that he was doing something, either putting the wrong codes. I think that the blood test place told me that the codes were missing for those tests. So he was leaving codes off of the test so that the insurance would bill me. And part of me was like, is he doing this deliberately or did he really forget? And I think a lot of doctors assume that you're too stupid and that you don't know that they're doing things that are kind of underhanded in order for you to go away. Because he obviously, after the first couple of appointments, I could tell that he did not want me as his patient. I'm a complicated patient. He knew that he wasn't going to get anywhere with me. And I think he just wanted me to go away. And so I started seeing this sort of underhanded, every time he would order a blood test, I would get a bill for like hundreds of dollars. And it wasn't anything fancy that he was ordering. I've had these blood tests run before. And I see a very similar pattern with other male doctors that, they'll tell you your issues are psychosomatic. I want to speak to your psychologist. I've been told, this test isn't available. I've been blocked from being able to schedule tests in certain departments. It seems, it's almost like they think I'm too stupid to figure out what it is that they're doing. And that's, it's really sad, but it's also an insult because it's like I've been around for a long time. I've seen many, 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 many doctors, and to assume that a patient is too stupid to figure out what they're doing is just, it's absolutely insulting. But I do get that vibe from a lot of male doctors, like, she's not going to know the difference. She's not going to know the difference, if I leave off a code here, or if I tell her, just you need to relax or something. I think there is this undertone of, you're not very smart. And I often wonder if men deal with this kind of situation, with male doctors, because I think I'm likely to believe that male doctors will listen to male patients a little bit more, and there's also, I think, maybe a fear of aggression because men are seen as more aggressive. So I think doctors in general are less likely to mess around with men and to be, condescending towards men because maybe men are a little bit more aggressive. But I don't know. Those are just my own guesses. But at this point, I have, I think I have 5 female doctors. I have an oncologist, an immunologist, a neurologist, my primary care actually retired, which I was very, very sad. But I have another different female primary care, and the urgent care doctor who's also a female. I have a female therapist and 1 male neurologist. And of those 7, 6, 7 doctors, the male neurologist is the one that literally I'll be like mid-sentence and he's like, okay, like, we're good for today. And I see him once every 6 months. The other doctors have been very, very good. I am noticing as time has gone on, and once I received my diagnosis, my female doctors have started really taking things seriously. For example, the oncologist who's ordered, several mammograms at this point. And the only doctor that still remains, kind of like whatever is that male neurologist. I don't think that's a coincidence. I really, really don't. But I have learned that, if I go for my, like if I go for a pap smear or for, some kind of something that's not, like frequent, if I have to go to a specialist, I will look for a female specialist, because I don't, um, I no longer trust male doctors, and I really don't think that they take women seriously. I don't think they take anybody seriously, but particularly women. So I do think that gender makes a difference. So for those of you ladies out there that are pursuing a diagnosis or looking for a specific doctor, I would highly recommend trying to find a female doctor, because I think you will be taken more seriously in the long run. So that's what I've got for you guys today. Leave a comment down below. Let me know if you feel that gender makes a difference when it comes to your medical treatment. Please like and subscribe, and I will see you in the next one. Take care.